Hello everyone. I'm glad to meet you here today. I hope you are very well and safe. My name is Mohammed Bukhari Yusuh, PhD student from University of Southampton, United Kingdom. Well, today I would like to give a presentation with the title Manuka honey efficiently counteract TNF-α induced human urothelial cell damage in an inflammatory model of bladder pain syndrome or interstitial cystitis as novel finding. Um, well, let's talk about bladder pain syndrome or interstitial cystitis, and I will simply call BPSIC in the rest of my presentation. BPSIC is a debilitating disease or chronic disease. It has been and still is poorly, incompletely understood in terms of physiology and etiology. According to NIDDK, AUA, ICS, and so on, they are characterized by pelvic pain, urgency, frequency, and then nocturia. This also affects the quality of life, such as sleeping, working, stress, anxiety, household, childcare responsibilities, and also financial hardship. As I mentioned that it was unclear what the probably causes. However, there were probably causes such as leaky bladder lining, histamine release from muscles, autoimmune responses, um, toxic urines, and also post-surgical conditions. So there are several treatments for BPSIC, such as instillation, oral modification, modified diets, and surgery. Mostly, patients have been treated in combination. However, there is no cure for BPSIC. It just offers some relief until now. So we more talk about honey in brief. It has been used as traditional medicine from ancient times. Several researchers have reported that honey has been acted as anti-inflammatory, anti-microbial, antioxidant, kills cancer cells, from angiogenesis, accelerated wound healing, and also reduce pain in wound healing. For the objective of my work, to investigate the efficacy of Manuka honey on the human urothelial cells damage in an inflammatory in vitro of BPSIC model. For the method and methods, the MTT assays were used to evaluate the effects of Manuka honey on the primary human urothelial cells, and the ELISA assays were used to assess the production of the pro-inflammatory cytokines interleukin 6 and also interleukin 8. For the result, the graph in figure 1 show the effects of various dilution of Manuka honey on primary human urothelial cells viability and cytotoxicity after exposure at various time points. I mean from 30 minutes to 72 hours. So from the graph show that 2% and 4% of Manuka honey were well tolerated by human urothelial cells at 30 minutes, 1 hour, 1.5 hour, 2 hours, and 24 hours. Whereas 6% and 8% of Manuka honey showed significantly cytotoxic effects at all exposure time points. The graph in figure 2 show the representative 4% of Manuka honey effects on interleukin 6 and interleukin 8 expression in the human urothelial cells challenged by TNF-α. So the graph, you can see that TNF-α shows significantly increase the expression of interleukin 6 and interleukin 8. However, pre-treatment with 4% of Manuka honey show significantly decreased both cytokines, like the bar graph here. So at the end of my presentation, I can conclude that pre-treatment with 4% of Manuka honey improved the recovery of human uterine cells after damage in vitro model of BPSIC. These results have established a novel in vitro clinical relevant model to assess the efficacy of Manuka honey in therapeutic agents for the treatments of BPSIC. So it's strongly to state that Manuka honey preparation could be useful as an additional intravesical agents for the clinical management of BPSIC. Thank you.